My name is Anna Lauren Parker.
And my name is Lindsay Parker.
We are both graduate student clinicians here to talk to you today about the administration, scoring, and general impressions of the Preschool Language Scales 5th edition. As you can see, there are many components to the PLS-5. An examiner's manual, an administration and scoring manual, a picture manual, and various visual and tactile stimuli, including but not limited to balls, blocks, books, bowls, bubbles, cars, ducks, keys, a bear, and wind-up toys. This may seem overwhelming, but I assure you this test is very efficient and easy to administer for any clinician who desires to use reliable and engaging manipulatives to test the child's language abilities, as we are about to show you in this presentation. The PLS-5 offers you a comprehensive developmental language assessment with items that range from pre-verbal, interaction-based skills to emerging language to early literacy. It is an interactive, play-based assessment addressing language skills for children ages birth through 7. There is a Spanish edition that was revised in 2012. The PLS can be used to help you determine if a child has a language delay or disorder, determine if a child has primarily a receptive or expressive language delay or disorder, or a delay or disorder that involves both. Determine eligibility for early intervention or speech and language services. Identify receptive and expressive language skills in the area of attention, gesture, play, vocal development, social communication, vocabulary, concepts, language structure, integrative language, and emergent literacy. Identify a child's language strengths and weaknesses so that appropriate interventions can be provided. Measure efficacy of speech and language treatment. There are some supplemental measures that the PLS provides as well. An articulation screener with visual stimuli is used for children's ages 2 years 0 months to 7 years 11 months. A word list is provided that targets age-appropriate phonemes and easily identifiable visual stimuli. This articulation screener is very easy to use in that the clinician simply places a plus for correct productions and a minus for incorrect productions. A home communication questionnaire was developed to gain the caregiver's perspective of the child's communication behaviors outside the testing environment. This questionnaire is appropriate for children ages 6 months through 2 years 11 months. A language sample checklist is provided to gauge the child's productions of language and spontaneous speech that were not elicited from this test. This sample checklist examines thoroughly a child's spontaneous speech for language development and mastery in the areas of morphology, syntax, semantics, pragmatics, and speech intelligibility. On the auditory comprehension subtest, there are many different developmental tasks ranging in difficulty levels from easiest, birth to 2 months old, starting with tasks as simple as glancing and reacting to sounds, to most difficult at 7 years 11 months, such as understanding prefixes and following multi-step directions. Today we are going to guide you through one of the auditory comprehension tasks. The following activity is for ages 6 years 6 months to 6 years 11 months. The clinician will start out by presenting pictures to the child about the qualitative concepts of biggest and smallest. Then the clinician will provide the following model. Here are 3 dogs. I will point to the dogs in order from biggest to smallest. Then the clinician will point. With cueing if needed, the clinician will prompt the child to try the next one using the following script. Here are 3 elephants. Point to the elephants in order from biggest to smallest. On the next question, the order will flip from biggest to smallest to biggest to ensure the child is using auditory comprehension skills to decipher the change. Scoring is relatively simple. The clinician will simply circle a 1 next to the question for a correct answer and a 0 for incorrect answers. There is a basal and a ceiling on this test. The basal for the auditory comprehension and expressive communication scale is achieved when a child has responded correctly to the first 3 consecutive numbered items from the start point for the child's age level. If the child does not achieve a basal for his or her age level, go back to the starting point for the preceding age level and move forward from there. A ceiling is achieved when a child has earned a score of 0 on 6 consecutive numbered items in a scale. On the expressive communication subtest, there are many different developmental tasks ranging in difficulty levels from easiest, birth to 2 months old, starting with tasks as simple as suck-swallow reflexes to most difficult at 7 years 11 months, such as using past tense forms and irregular plurals. As done previously, we are going to guide you through an example task for the expressive communication portion. The clinician will present the child with multiple objects and give the child an opportunity to respond with the appropriate label of each familiar object. Articulation errors are acceptable if it appears that the child is approximating a word and the caregiver can translate the word. There are multiple assessment methods. You may observe the child producing different words any time during testing. You can mark E if you elicit the target behavior using the prescribed elicitation procedure, or O if you observe the child saying the target behavior in spontaneous interactions with the client or the caregiver. Scoring is consistent with the auditory comprehension portion of the test. The clinician will circle a 1 if the child produces 5 words describing the objects. The clinician will simply circle a 0 for responses less than 5 words.
The PLS-5 yields norm reference scores such as standard scores, percentile ranks, and age equivalents for the auditory comprehension and expressive communication scales. A norm reference total language score can also be calculated. This is an example table from the PLS-5 record form. This child is a 3-year, 4-month-old male who we will call Jimmy. Jimmy attained a raw score of 31 in auditory comprehension. This reflects the last auditory comprehension item administered minus the number of incorrect responses. He received a standard score of 79, which was found by comparing his raw score to peers of the same age. The confidence interval was based on the clinician's choosing of a 90% confidence level. The confidence interval reflects how confident the clinician is that the standard scores were valid. Therefore, they are 90% confident, leaving a chance to the remaining 10%. The confidence interval of 74 to 88, based on Jimmy's percentile rank of 8, this means only 8% of the children at his age level scored the same or lower than him. Standard scores or percentile ranks must be used to compare a child's performance to others of the same age. This information compiled Jimmy's age equivalents when compared to the norms. The norm reference score are provided for children ranging from birth to 7 years, 11 months. Here is a list of age ranges and approximal times for administration. These times are based on standardized data that are average times that may vary depending on the child's age, ability, or cooperation. We have birth to 11 months would take 25 to 35 minutes. 12 months to 2 years, 11 months, 45 to 55 minutes. 3 years, 4 months to 11 months. 3 years to 4 years and 11 months would be 50 to 60 minutes. 5 years to 7 years, 11 months would be 40 to 50 minutes. To better ensure these approximate times, it is important that the clinician build rapport with the child, whether through conversation or interactive games or playing. Children may lose attention or express fatigue throughout the administration. Encourage the child to take a bathroom break or water break, or maybe stretch when needed. Clinicians should be attentive to the child's body language for these signs. We determined through intensive study and observation that the PLS-5 was easy to learn and engaging for preschool children. Gross scale values can be calculated to monitor progress over multiple test administrations for children ages birth to 7 years 11 months. This test allows for modification of administration for the following special populations: severe developmental delay, severe physical impairment, hearing impairments, children who use sign language, visual impairment, and autism spectrum disorders. There are multiple assessment methods. You may observe the child producing different words during any time during the test. You can mark E if you elicit the target behavior using the prescribed elicitation procedure, or O if you observe the child saying the target behavior in spontaneous interactions with the client or caregiver.